He's Skinny Medic on the channel. Dietrich is also goes to my church, which this is my church, by the way, just FYI. But Dietrich's going to come up. He has been an EMT in the EMS industry for about 8 years or longer. He is an instructor. He teaches different classes. And if you've seen my channel on gunshot wounds and things like that, we've addressed it. But he's going to bring a very important subject up. So Dietrich, come on up, Skinny Medic, and give him a good hand.
I wanted to put this up here, not because I'm bragging, not because of anything, but mainly because I look like I'm 12 years old. Okay? I know I look like I'm 12, so I wanted to put this up here saying I can at least drive. After dark's a little questionable sometimes, but I can drive. I've been in EMS for 8 years, been a paramedic. I worked for one of the busiest systems in South Carolina, Greenville County EMS. They're the biggest, largest. They run over 60,000 calls a year. So I'm also an instructor. I teach anything from paramedic to EMT basic, first responder classes, advanced cardiac life support, pre-hospital trauma life support. So I teach a good bit. I'm a very busy guy. I have a 7-week-old little girl, I have a 3-year-old little boy, and I've been starting a private EMS service. So that's why there's been no videos on my YouTube channel for like the past 6 months. And I apologize about that. But working 2 full-time jobs and a family has just been really difficult. So family comes first. You guys understand that. So that's what I've been working on. I competed here regionally for a paramedic competition, and I won. Got me a fancy little t-shirt, so that's good. We competed 2 years ago at a wilderness competition in Virginia. Basically, they would give you your waypoints, your coordinates, and say, there's your first patient, have a nice day. We go to that patient, we treat our first patient, and then we go to the next one. We place in the top 10 over teams across the country. So we had a good time doing that. I review books, they write chapters. I say, okay, the lung actually has 3 lobes, they have 2 lobes, so kind of do that. And I'm a director for a private EMS service now. We do private transports for the elderly. We think that's a service that we can provide to the community, and we enjoy doing that. I guess I gotta hold on this little remote. Okay, my first lecture today is going to be on trauma. I say lecture, but I don't want you guys to fall asleep. So my first talk is going to be on trauma. This guy's actually alive and talking at this moment, by the way. This is a 12 gauge to his face. So I want to get a good gruesome picture so everybody can wake up. This is going to be a real quick lecture or talk about trauma assessment. I'm not here to teach you everything you need to know about trauma, guys. I cannot do it. The paramedic is an associate's degree. It's over 2,000 hours for me to teach you everything about being a paramedic. I cannot do that. What I will encourage you to do is take a first responder class, take a basic first aid class, American Red Cross. Your local EMS services will do that, and enjoy it. It's something that we talked about in Japan. If something happens here, like over here, Greenville County's response time right now, if we call an ambulance, could possibly take them 12 minutes to get here. Okay? But what happens if there's a huge bus wreck on Interstate 85 right now? Or what happens if there's an earthquake here right now? How long do you think it would take an ambulance to get here? You may not get an ambulance. They may say sorry. So being your first responder, being your somewhat medically oriented, trauma oriented, is very important. Because we never know. We depend on EMS. We depend on our hospital systems. But if something happens, a really traumatic injury here, then the hospitals are going to be overwhelmed, the doctor's offices are going to be overwhelmed, and you may or may not get an ambulance. So it's very important that we learn a little bit about this. I'm going to talk about the golden time period. For those who are EMS related here, you used to talk about a golden hour. You've heard it on the old Rescue 911. That is no longer the case anymore. It's actually a golden time period is what they're talking about. The golden hour used to be you had an hour every time your arm got cut or you in the OR. Well, if your arm or your femoral artery gets cut, you have about 3 minutes to stay alive or you die. So that hour really doesn't come to effect there. If your femoral artery gets cut, it's about the size of a hose pipe and you can bleed out before you get out to the parking lot if you don't know how to fix it. Recognize quickly these trauma assessments, we're going to talk about that, and then management of life threats. Sync sized up. I don't know if you can see it very well, but those are some guys that are in level B suits. They're not quite level A, but those are level B suits. And they're doing something with hazmat related, and you see a guy standing in short and t-shirts. Scene size up is very, very important, okay? Scene safety is number one, okay? If you get hurt, or you're a family member, or if I get hurt, I'm no good to you. So, being scene safety, making sure that the scene is safe. Whether this be out in the wilderness, or be out in the parking lot where somebody's been shot, or something like that, we've got to make sure that the scene is safe for us. Because if we get hurt, I'm no good to you. So making sure that the scene is safe. Sorry, I can't stand still, so I apologize. How does the situation look? Do I have someone that's off in a ravine that I cannot get to? Or is there a bunch of gangsters standing around this kid that's been shot? I got to make this thing safe somehow, okay? If I'm not in uniform, I have a concealed weapon on, by the way. And I also have chickens and I garden and do all that stuff. So I'm with you, just so you know. Any hazards. If you smell something funny, you probably don't need to be smelling, okay? If you smell the sweet almonds, like Mike Wilson, we can talk about that. If you smell the sweet almonds, cyanide, you're probably dead anyway. So don't worry about that. But it's the hazards. Look for those. Look for that guy carrying the gun. Look for the guy walking through Walmart with a big butcher knife. That's always bad. We just had that recently here in the upstate. He was shot by 3 officers and lived. So that's a whole other subject. How many patients do you have? If I can go one-on-one with you, I can save your life, God willing. But if something happens to all of you, some of you are in trouble. Just saying. Where are they at? Can I get access to them? Do I need to put on a rappelling harness? Am I good with my ropes and knots? That's something we don't think about. Southern Prepper talks about rope, having a lot of rope. But if we don't practice our knot tying, we don't practice using these ropes, then we're too many times to come to like, oh, I have no idea how to tie this bowline or this figure-8 knot. Find and correct life threats. I tried to find some good pictures here, but we've all seen those where the knee is like pointed at a 90-degree angle or the arms twisted up above their head. Generally, that stuff will not kill you immediately. Eventually, yeah, infection's going to set in, and eventually, yes, you will die from that. But immediately, the ones you look at going, oh, wow, that looks really gross, it's probably not going to kill you. It's your airway that's going to kill you, your breathing, and your circulation. Okay, I think I put one of my slides. All bleeding stops eventually. Okay, so we got to get that stopped. If there's a life threat, we need to fix it. If there's a problem with this guy squirting blood halfway across the room, we need to stop it, okay, before it just bleeds all the way out and stops. So what is going to kill my patient? What is going to kill your brother? What is going to kill your wife, your little boy? Okay, if we're out in the wilderness, we're hiking, or we're out in the parking lot, what is going to kill them before EMS can get there? Your ABCs, your airway, breathing, circulation. Everything else can go on, okay? We can worry about infection later, but our airway, our breathing, and circulation is what's going to kill you immediately. And I talk really fast, so if you need to ask me questions afterwards, please by all means do. One of the main things we do is when we're going to control airway, we have to hold the head still, okay? Because if you move their head and they have a spinal cord fracture, bam, you might as well just give up. So we hold their head still. You don't have to pull traction. In one of the videos me and Sush did, we put backpacks on either side of his head, okay? Because if I reach down and hold this person's head, I'm done. I'm locked in place. So if you can just put backpacks, some kind of something to hold the head still. Because if you do have a spinal cord fracture, 1 centimeter of movement of the head will fracture the cord. And now you're paralyzed, your body's paralyzed, so that's no good. They'll probably get really mad at you. So hold the head still. That's the main thing. When you open the airway, there's a couple different things we can open the airway. And I've got but pictures in my next slide to make you stay later on in the afternoon. But hold the airway is a jaw thrust maneuver. If you take either point of your jaw and you push it like that, it's really painful, but it opens your patient's airway, okay? Noisy, bubbly, blood coming out of the mouth is a problem. So if we can open the patient's airway, clear it. Put it in a neutral position. We don't want to have your head at a 90-degree angle. Put it right back. And you don't have to pull traction, anything like that. Just hold it still, okay? Pillows, anything like that can hold the head still for you while you're trying to fix the bleeding that's going on. Airway. If open, maintain, and clear. Okay, so if we've got blood in the airway, we've got to clear that because where's the blood going to go that's in the patient's mouth? Probably back to the lungs. So if even this patient lives, they're going to die 3 months later from pneumonia. So we've got to get that clear. Got to go in. We can roll the patient on their side. That clears the airway. If you've got suction available, stuff like that, in your hand, get the teeth out of the way. But use whatever you can do to clear the airway, because this is going to be our number one priority. Anticipate airway problems with someone who has an altered level of consciousness. This may be a head injury, any type of involvement with the head. And noisy breathing is an obstructed airway. When people snore at night, that's because your tongue's obstructing your airway. Okay? That's the easiest way I know how to put it. If you have bubbling coming out of blood, that's a noisy airway, that's a problem. So if you do not clear that airway, that patient's going to die within a matter of about 8 minutes if we do not get the airway clear. If you can't get this clear, you might as well just walk away from them and move on to your next patient. Breathing, if you've had CPR, the whole look, listen, and feel, it works great. Okay? It still works. Even I've been CPR certified since I was like 13 years old, I believe. So I'm 28 now. So and still remember look, listen, and feel. I hate technology. Anyway, look, listen, and feel. If they don't look like they're breathing, they're probably not. Okay? If they're blue, they're probably not breathing. It's just really easy, as simple as that. A good pocket mask. They make them from a plastic case all the way you can stick them in your pocket. It's a good idea to have, because if they're not breathing, we can breathe for them. And something they don't teach you in CPR class is when you go into cardiac arrest, you have no pulse, you're not breathing, all your muscles relax. Okay? So all that beer and pizza you just had, guess where it's going? Up. So back 20 years ago when they were doing EMS and they had the white Cadillacs and they were doing mouth-to-mouth, that is gross. Okay, I do not do mouth-to-mouth. But they used to wipe the vomit out and go right back to it. That's gross. But we've got to keep that airway clear. So a good pocket mask is good to have. It doesn't take much room in your backpack, in your day bag. It doesn't take much room at all to have, and it's something that could actually save a life. We need to expose and palpate the chest. Here's 2 things in the breathing that we can find and fix that will kill our patient if we do not fix it within the next few minutes. I've put a flail chest in there. Basically, that is broken ribs. Okay? I'm not talking about a broken rib. One broken rib, put a pillow on it, you're going to be fine. When you start breaking multiple ribs, what's actually going to do is the ribs will sink in and the rib cage will go out. So they move, seesaw, breathe like that. What that will do is it will collapse one lung. So now you're down to one lung. And if you've been smoking for the past 20 years, or you're not running a marathon, you probably can't survive very long on one lung. So we need to fix that. Alright, how do we fix that? The easiest thing is to take your hand and put it on that patient's chest. Done. That will control the ribs and will prevent that lung from collapsing. Okay? We can also take a big pillow or any kind of bulky dressing and put it right there. That will stop this flow segment and will save your patient's life. Okay? Whether they've fallen down a ravine, fallen hiking, or if they've been in a car wreck, this will save your patient's life. Just as that simple. Open wounds. Gunshot wounds, knife wounds, it creates an air pressure into the chest. Air goes in and out through the mouth. But it's going to take the least route of resistance when it does this. So if you have a gunshot wound or a knife wound, guess what the easiest route is? Right here. So guess what you're not doing? You're not ventilating. The easiest thing to do here, once again, put a hand on it. Your hand can fix a lot of things in this trauma situation. Put your hand on it, that will create a seal. When you create the seal, your patient will start breathing again, where they were once blue, now they're going to start looking warm and pink again and start looking a lot better. So, those 2 simple things, basically remember that if you expose this person's chest, is to put your gloved hand. Now, I'm not saying that on your way home, you run across a car wreck, and you see a 19-year-old supermodel that's been in a car wreck. Do not open her chest up, okay? Don't say, oh, I got to do this. Skinny medic told me to. And cut her shirt off. Please do not do that, okay? Because I don't want to get any emails on that. But this is talking about life-threatening injuries. One of my last slides here says if they look sick, they probably are sick. We've all seen this on the news. We've seen it on TV. We've seen it in real life going, oh, they do not look good. If they don't look good, they're probably not doing very well. But do not expose a 19-year-old supermodel's chest because skinny medics told you to. Circulation. Is their heart beating? This is really easy to find out, okay? Put your hand on their wrist or on the side of their neck. If you feel bump, 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 their heart's beating, okay? It might not be beating very